So public health for me is all about going upstream and trying to stop things happening before they start. There's lots of different elements of it, so you can really find your place within the specialty. People don't go into public health for fame or fortune, because a lot of what we do is actually in the background, and if we do our job right, you shouldn't really know we're there. It does give you the opportunity to make a really meaningful difference at a population level. You have more control, or at least the ability to feed into national policy, regional policy, local strategy. Long term, it really feels like we make really, really meaningful impact on a whole population. Training is a 5-year program, and most people would start with a master's in public health. It's also a really friendly specialty, particularly here in the Northeast. We know all of the consultants very well. Throughout training, you kind of rotate between so many things and you meet everybody. And it's always felt like a very supportive environment for me. We kind of talked about ourselves as being the public health family. I've also had the opportunity to do a part-funded master's in medical education, which has been funded through the NHS England, which I found really beneficial to me. And other colleagues have taken opportunities to do kind of regional placements like I have, but also national and international projects as those opportunities come up. And I find the public health training program here in the Northeast has been really supportive of people taking up those opportunities. This year I've worked closely with colleagues from across the system to develop a regional HIV action plan. So I've spent a lot of time making sure we get the right people in the right room to talk to each other, that we've got improved working, so right from prevention to testing, right up to care, that has become more seamless, that everybody knows what's happening in other parts of the system. However, that probably hasn't had an impact on somebody currently living with HIV just yet, but I'm very confident that in a few years' time it really, really will. For anyone who's thinking of joining public health, I'd say come on in. It's a very open and welcoming place to be. We are quite unique in terms of we don't just have doctors within public health. We also have trainees coming from a variety of other backgrounds, and I think that really adds to the richness of our workforce. If you're interested, get in touch. Our training program director is very friendly. The Northeast and North Cumbria had so much to offer, and there was a whole host of reasons that I wanted to move here to do my public health training. For me personally, one of the biggest draws was the size of the region. That for me meant that I could live in one place and not have to move every year, and I think that was something that was particularly important, so that when moving to a new place I could put down roots and really start to feel like I was at home. One of the other things that was really important to me is how welcoming and friendly the people are. So the Northeast is definitely one of the most friendliest parts of the UK that I've visited so far. For me, it felt more like Ireland than anywhere else I've visited, and that made me feel more at home immediately. I've gotten really into running since I've moved to the Northeast. I started off with park runs and then have recently joined a local running club, and then our office here also have a running club on a Tuesday at lunchtime. It's a really good way of making friends and meeting different people, and it's a very social way of getting in your exercise as well. The cities have everything that you would need from a city. So Newcastle has all of the really good restaurants, cafes, bakeries, really good theatre, lots of venues for music and things like that. So it has everything you would need from that point of view, but just a 20-minute drive out of the city and suddenly you're along the most stunning coastline, or go the other direction and suddenly you're out in countryside with rolling hills. So I just think it has something for everyone.